on the three things that Dr. Jose Ramon talked about that are important in organization of donation and transplantation as far as it pertains to the United States. And those will be the legal framework, the type of the donor, and the organizational structure. And I will just bring attention to some aspects that might be a little bit different than what we've heard so far this morning. And some of these aspects, one of the reasons we are here is to share our experiences and see if we find better ways we could do things, learning from the others. And so let me start with the legal framework. And I think the legal framework for donation and transplantation is important because it gives us rules for how to do things. In the United States, the Uniform Anatomical Gift Act was passed in 1968, and it established donation as a voluntary and altruistic act. It determined the ways the individual could make the donation. It established priority order among relatives when consent for donation was being sought. It limited the liability of healthcare providers. So for us, the healthcare providers, when we acted in good faith and proceeded with donation, if there was some litigation after that fact, actually the healthcare providers had limited liability as long as they acted in good faith. And it also prohibits organ trafficking for profit. So while most countries have similar legal frameworks, one thing that I think is important, and you see here that the Anatomical Gift Act was updated in '87 and 2006, that we not only think about how is the legal framework structured or established initially, but the way we see donation and transplantation evolves, the ethical concepts of legal donation and transplantation evolves. So I think it's important also to think, are there time points where it would be important to update the legal framework? So that, just as an example, the last update to the Uniform Anatomical Gift Act in the United States happened in 2006. And I think some important things were established there. One is protocols for states to set up donor registries. So registries for donors to say, yes, if I end up in a situation where donation could be considered, I cannot make decisions, I would like to, through registry, express my opinion. So driver's licenses were established as a way for donors to designate their wish and for this way to be legally binding. And also for organ procurement organizations, and I'll talk about those in a little bit later, were granted access to these donor registries, medical records, and motor vehicle records, so that the OPOs are able to access these records and be able to tell if that potential donor has designated themselves as a donor while they were alive. Now, another important aspect, I think, is, and we've heard experience from Spain, is that many donors are at hospitals that are not transplant hospitals. So education needs to happen there as well as far as donation and transplantation. And sometimes the best way to achieve results is regulation, as much as we don't like regulation sometimes. So the organizations that regulate hospitals in the United States, the payers and the regulatory organizations actually have rules that assure that families of patients who could be potential donors are approached in the hospitals. So hospitals are required to notify local organ procurement organizations of not only all deaths that happen in the hospital, but also all imminent deaths. And audits can be conducted where licenses are given to the hospitals that actually check whether all hospitals, not just the transplant hospitals, but all hospitals comply with these notification rules. So that's the legislature as far as the process of donation. Well, how about the logistics? How does that happen? And again, the legislation was passed in 1984. An organ procurement and transplantation network was established. a slightly different way that logistics work in the United States is that the contract for running this network is awarded by the government to a private organization, private non-for-profit. And this organization since 1986 has been the United Network for Organ Sharing, or UNOS, and it operates under the government contract. And the core activities of UNOS are to match donors and recipients. It mandates clinical data collection, so all hospitals that want to participate in transplantation need to collect data at the time of transplantation and long term. It makes sure that hospitals adhere to UNOS policy, raises public awareness, and interestingly, also they have a mandate to promote research in the field of transplantation and donation. And finally, organ procurement organizations. And again, I think this is something a little bit different than in many countries. Organ procurement organizations are, again, private, non-for-profit organizations. And there's about 58 in the United States. And their charge is, so they're separate from the hospitals, and their charge is to obtain consent for organ and tissue donation, to manage the donors. So it's very clearly established who is in charge of managing the donor when they reach brain death. So a brain death donor at the time of reaching brain death actually comes from management by the hospital to management by advanced clinical practitioners of organ procurement organization, of course with an input of the clinicians at the hospital. Importantly also, the charges are no longer going to the insurance companies for that patient, but they are being paid by the organ procurement organization and recovered through the transplant process. They do the boots on the ground organ allocation, organ recovery and transportation, and they are also charged with education, public awareness, and research. Now, again, going back to regulation, you saw that there's a number of organ procurement organizations, and these organ procurement organizations are under more and more scrutiny as far as their performance. So there's a number of metrics that are being examined, and I'll just show you one metric as an example from our organ procurement organization in Utah that we track very closely, and that is, what is the ineligible donors, what is the OPO's achieved consent rate, meaning how many donors who are eligible would say yes, or their families would say yes to donation, and then of those, how many donors actually proceed to donate organs to transplantation, and it's called conversion rates. And all the 58 organizations need to collect these data, report these data, and if they fall short of the expectations, they need to make changes to achieve better results. Now, as we saw also in the presentation from Argentina, despite fairly similar rules, identical legislation and fairly similar logistics, there is still geographic variation in donation across the different states in the United States, and of course research and education is being promoted to achieve universally high donation rate across the country. I think donation registries helped us a lot, and here you see again the state compared themselves as far as how many inhabitants in the particular state have signed up through donor registries and other means to be donor if necessary. So in summary, these are, I think, some of the important points to continue to increase our donation rates and transplantation rate. Legislature is important, but we need to remember that it needs to be updated if necessary, and that should be pursued aggressively. The public needs to be on board as far as awareness of donation. Not only the transplant hospitals, but all hospitals need to take active participation in donation. I think organ procurement organizations are very important, and they need to be held under strict metrics as well as we are in the hospitals. And of course, transplant hospitals should be active along all these different points to participate, to achieve good rates of transplantation across the country. And I'll finish with this, and if there's a discussion, I will also ask Dr. Higgins to provide his input as the past president of UNOS. Thank you very much.
Well, very briefly, I want to congratulate the organizers and the Minister for this fantastic initiative. Transplantation, as you know, provides extraordinary life-saving and life-enhancing capabilities. In the United States, as the president of the United Network for Organ Sharing, we serve close to 120,000 potential recipients who are waiting for these life-saving and life-enhancing organ transplants. The obvious challenge is that, as we've heard from around the world and in Central and Latin America, the number of donors and the supply of potential organs is far shorter than the demand for those life-enhancing organs. The majority of recipients in the United States are those who have end-stage renal disease, who have often been on dialysis, and we know that the life-limiting issues on dialysis prevents them from having a good long-term expectation of life and quality of life, which is diminished. So renal transplantation is an important area where we are advancing the cause through living donation as a means to enhance organ donation and life-saving transplants. A number of initiatives, including non-related living donation and pairing, have now been mandated legislatively, and this has had a significant impact on the overall transplant rate. Heart, lung, liver, and pancreas continue to require additional initiatives where living donation is not an option. I think that your efforts today will help to identify regional and national standards, guidelines, and best practices which will advance the cause of organ donation and transplantation. We appreciate the invitation to participate and share experiences from the United States. As you'll hear later today about the overall structure of the system, and as you've heard just a few minutes ago, as well as ways to collaborate with you and enhance the legal and regulatory framework to advance the cause. Thank you very much, and congratulations again.